If you've been told your pain is normal and you've waited years for answers, or had a doctor tell you the only way to know if those symptoms are from endometriosis is surgery, this video is for you. You may have heard a lot on Instagram, on TikTok, in the news about non-invasive tests for endometriosis. It sounds amazing. In this video, I'm going to break down what tests are available, what the research shows, and what questions to ask your doctor. I'm Dr. Lora, Shahine, a double board certified OBGYN and reproductive endocrinologist helping people with endometriosis for over 20 years. And I am so excited about the new technology that is available. I think it is very promising, but I want to break it down for you because some of these aren't even available in the United States yet. And a lot have amazing claims from the manufacturers, but the research is lagging. So there's a lot of promise. Some things are available, but I really want you to understand exactly what's going on. I want to separate the research from the hype. If this is your first time finding my channel, welcome. I am so glad you're here. Be sure and subscribe so you don't miss any of my reproductive health education videos. And if you're coming back because you found my education and topics valuable, welcome back. I am so glad that you're here. You should know there are lots of ways to keep learning from me, stay in touch. Number one, you can sign up for my newsletter. The link is in the description below. And number two, I have an incredible Brave and Curious podcast. You can listen anywhere you listen to podcasts. You can see video interviews here on my YouTube channel. This is a wonderful deep dive into fertility, reproductive health, and other health topics. Lots of learning on the Brave and Curious podcast. Now, today we are focused on endometriosis, and I'm going to go through four main topics for you. Number one, we'll do a recap. I want you to be very clear about exactly what endometriosis is and how it's traditionally diagnosed. Number two, I'm going to go over the research and the new non-invasive tests that are available and becoming available very soon. Topic number three, we'll do a recap, and then I'm going to remind you of ACOG's updated diagnosis of endometriosis. ACOG is the American College of Obstetricians and Gynecologists in the United States, and they did an incredible update in March 2026 about diagnosing endometriosis based on patient history alone. So I'm going to remind you of that. And finally, stick around to the end where I'm going to cover some very important questions to ask your doctor. Topic number one, let's make sure we understand exactly what endometriosis is. Endometriosis is a chronic estrogen-dependent inflammatory condition. It typically presents with pain with periods, pain with intercourse, and cyclical signs and symptoms like GI changes, bladder pain, specifically around the hormone changes that happen with your period. Now, endometriosis can present in many ways. This is just the most typical presentation. As a fertility doctor, I am always thinking about endometriosis being a part of the fertility picture and the couple or the person that is sitting in front of me. Now, not everyone with endometriosis will have infertility, and not everyone with difficulty conceiving will have endometriosis, but it's something that can go hand in hand, and it's something to always think about. Symptoms that I described for endometriosis are typically from lesions that are found throughout the body, most typically in the pelvis, in the abdomen, on the outside of the uterus, within and on top of the ovaries, along the fallopian tubes. And these lesions are not supposed to be there. And you can see them when you are doing surgery. You can look at them directly. You can do a biopsy and look at them underneath the microscope, and they look like the lining of the uterus. So every cycle, the uterus builds up a uterine lining, the endometrial lining, in order to accept an embryo and to be pregnant. And if someone's not pregnant, hormone levels drop and that lining sheds. That is menses. Now, this tissue, if it's found not inside the uterus, but outside of the uterus and throughout the body, this tissue, you can look at it. It looks a certain way under the microscope. It's got certain components that you can test for. And if it's found outside of the uterus, this is a definition and diagnosis of endometriosis. And the issue is that for decades, the only accepted way to get a true medical diagnosis of endometriosis is to have a surgery, see these lesions, and then very often the surgeon will do a biopsy to confirm it with a pathologist looking at it and testing it under the microscope. You don't actually have to have the pathology diagnosis. You can just have an experienced surgeon look and see these lesions and say, I've seen them. This person has endometriosis. And this requirement for surgery and visualization of these lesions for a medical diagnosis of endometriosis has led to significant delays in diagnosis, worsening of symptoms, worsening of disease, because it's not so easy to get a surgery, or every medical intervention and surgery has side effects and issues, and sometimes people are really nervous about undergoing surgery, so there's often a delay. There's so many women that talk about being dismissed by their doctor for these horrible symptoms that they're having. They've been told by their doctor, by their family, by their friends, like, oh, everybody has cramps with the period, like, just get over it. And sometimes when you really listen to women, this is debilitating pain and it's really impacting their everyday life. But yet they still don't get the diagnosis. They still don't get help that's available because they don't technically have the diagnosis. So the thought that we could have non-invasive testing, like get a definitive diagnosis without having to do surgery, is wonderful and incredible. And I am so glad that we are looking into this. And that is what we're going to talk about next. Topic number 2, the new available and soon to be available non-invasive testing for endometriosis. There are 4 types of non-invasive tests that have been talked about. The buzz is out there. I'm going to go through each one. I'm going to tell you what it is, how the test is done. I'm going to share with you the research behind it. I'm going to share with you whether it's available or not available. And I'll give you a little summary of this test and where I think it is as far as its reliability, its ability to be actually used, especially in the US. So overview, research, and then kind of the lowdown on each of these tests. Test number 1, the endo test. This is a saliva-based test where you're testing microRNA that could be signaling endometriosis, and it's by a company called ZWIG. So what is this test? How does it work? It is a saliva test. So you spit into a tube, and the lab analyzes for over 109 microRNAs that are specific to endometriosis. MicroRNA are these small signals that reflect gene activity, and AI is actually utilized to analyze the data that comes from the saliva and genetic testing. Where is this in development? It's actually the furthest along of all the tests that I'm going to describe. It's commercially available now in parts of Europe, including the UK, Ireland, and France. It's typically self-pay, and it can cost hundreds to £1,000. In the UK, there's a national group or body that analyzes tests and new technology for medicine. And this NICE program, which stands for National Institute for Healthcare Excellence, gave it a conditional early value support in its 2026 NHS complementary tool. So it's not a standalone full endorsement from this group in the UK. As of this recording, which is August 2026, it is not available in the United States. It is not cleared by the FDA to be used here in the US. What does the research say? There's a validation study that came out in the New England Journal of Medicine with a prospective design. There were 971 symptomatic women in 17 hospitals in France, and it was interpreted by a blind analysis. The reported sensitivity was 97%, specificity 94%, and overall accuracy is 96%. So this is really strong evidence. Honest caveats of the study: this was only done in women that already had a very strong suspicion of endometriosis, so significant symptoms that sort of sounded like endometriosis. This is promising. This is usable today, again, in some parts of the world, but not the United States. My interpretation, this sounds very exciting, and it would be great to have this available to kind of rule in and rule out suspicion of endometriosis, but it cannot substitute for clinical judgment and experience. Second test, EndoSure. This is an abdominal sensor test, and it's actually using electrical signals to test a suspicion of endometriosis. So how does it work? It's a non-invasive test in which electrodes are placed on the abdomen and censoring for activity, kind of like a ECG. It's measuring myoelectrical signals from the GI tract. So the premise is that inflammation from endometriosis can stimulate prostaglandins and overreacting and the electrical signals in the GI system. Patients lie flat and have these electrodes on their belly for about 30 to 45 minutes, and then the tests are interpreted. Where is it in development? This is at a much earlier stage compared to the endo tests that I described earlier. In the US, it's only available as a part of a research study. In the UK, with the NICE group, they gave it just like the endo test, like an early use pathway, may be complementary to clinical diagnosis and clinical judgment, but it's not fully endorsed yet in the UK. Apparently, there are in the works of a home device to help with testing at home. What does the research show? The manufacturer reports very high success at detecting endometriosis with 98 to 99% accuracy compared to surgical diagnosis with endometriosis, and they report no false negative findings. To be honest, though, these are numbers that are reported by the manufacturer. This is not an independent peer-reviewed research trial. So it's promising, but it's not as promising or as further along in validation as the endo test, that saliva test we just talked about. The third test is using molecular imaging to screen for endometriosis. It's a tiny amount of a radioactive tracer is injected into the bloodstream of a patient with suspected endometriosis. And this 99-MTC maracyclotide is that little tracer. It supposedly attaches to integrins, and integrins are linked to new blood vessels. And endometriosis is notorious for angiogenesis, or making new blood vessels in active endometriosis lesions as they're growing. So this little tiny radioactive tracer is attaching to a part of a new system that is really common and active and inflamed with endometriosis lesions. And then the patient gets a SPECT CT scan, and wherever this tracer is attached to integrins, it's going to light up on the CT scan. The exciting part about this option is it might be able to detect really superficial peritoneal lesions, which are notoriously very difficult to see on regular CT scan or MRI or ultrasound. Where is this in development? It's still experimental. It's a research tool. It's not something that patients can request yet. There's one study that I could find that was published. It's a phase 2 study reported in the Lancet OBGYN journal. It was about 20 patients and showing, positive results. It has FDA fast track designation, so we're looking at it for use in the US. And phase 3, or kind of final international trials, are in the works to hopefully be completed by the end of 2026. So stay tuned. So does the research support it? Well, early results are encouraging. There's an imaging concordant with surgical findings in about 16 out of 19 cases reported. There were no false positives reported, and it did flag lesions that traditional MRI and ultrasounds did miss. Big caveat, this is a very small study, so it's exciting, it's interesting, but it is not ready for prime time. The final test is using advanced imaging with AI to interpret the data. It's high-resolution ultrasound and MRI. So what is it and how does it work? Well, it's in 2 steps. Number 1, you have to have very specific protocols and technicians that can do very detailed and protocol-specific imaging, like collecting the imaging on the ultrasound, collecting the imaging on the MRI. And the second phase is using AI to interpret the data that the specialized and sort of well-trained technician used to get those images. So where is this in development? It's actually available now, but you really need to look for places that are doing this really well. It's very operator dependent and interpretation dependent. The AI layer, where you're interpreting the data that the technician is gathering, is also really on the research side. We're learning a lot, but we still have a ways to go. Does the research support this yet? So systemic reviews of some AI interpreted ultrasounds and deep learning has shown some promising results. One study showed an 89 to 93% accuracy, What I could find is that this is interesting, it's great, it's very operator dependent. If you're looking for this type of imaging, just be very careful, ask a lot of questions about experience with it. And I do think that this is eventually only going to get better and better. So let's do a quick recap of these tests and then a little reminder of ACOG's new diagnostic criteria. So we talked about 4 tests for non-invasive detection of endometriosis. So trying to detect endometriosis without having to do surgery. We talked about the endo test. That's the saliva-based test that is currently available in some parts of Europe. Promising results, even one study published in the New England Journal of Medicine. Number 2, the EndoSure test, where electrodes are placed on the patient's abdomen and pelvis, and it's picking up electronic signals that can change with a stimulated GI system from active endometriosis. Still under research, very interesting. I love the idea of a test where all you have to do is lie there and like take a nap. And I love that they're thinking about at-home devices to help with diagnosis, but still not ready for prime time. Test number 3, that Mara cyclic radioactive tracer test combined with CT imaging. That is exciting. I love that they're trying to find a technology that can find the very tiny lesions that often are missed in other type of imaging. So very promising. It does take some interpretation, and so just keep following. And finally, the advanced imaging with the very operator-dependent experience needed, and then AI interpretation of like ultrasound and MRI. I love that because you don't have to have the injection of the tracer. It's already available in some parts of the US. And if you're looking for it, just be very careful about the experience of the people that are doing the tests for you. Topic number 4, I want to remind you that in March 2026, ACOG, the American College of Obstetricians and Gynecologists, updated their diagnosis of endometriosis guidelines to include a clinical diagnosis of endometriosis is adequate for a diagnosis. So before I started hearing all the buzz about these new non-invasive tests, which I think are still very important, I just want to remind you that we already have the backing of our professional medical societies in the United States to give someone a diagnosis based on their clinical history and your clinical judgment. Like, I can talk to someone and I just know they have endometriosis with the experience that I have and just all of the patients that I have seen. I think it would be lovely to also have confirmatory tests, but we already are at a point where we can diagnose someone without surgery. It just takes listening to women and believing women and kind of understanding. That does not mean that we, ignore these non-invasive tests. I think it's very important. I think that there are times where endometriosis symptoms can be confusing, and you certainly don't want to assume it's endometriosis and you're really missing something else. But I did just want to remind you of that 2026 updated guidelines. We're already huge advancement in diagnosing endometriosis. I do have a whole YouTube video here where I go into a deep dive of those guidelines in order to teach you exactly what they did and how just remarkable and honestly like groundbreaking it was that they already did that. I'm glad you stuck around to the end. I want to leave you with some questions to ask your doctor. Here are 3. Question number 1, based on my clinical findings, the signs and symptoms that I'm explaining to you as my doctor, do I meet the criteria for a diagnosis of endometriosis? Remind your doctor of this updated guideline. I mean, this is less than 6 months ago at the time that I'm recording this, and there's so much information that comes out in medicine. There is a real chance that your doctor might not have heard of those updated guidelines from ACOG. And so in a very polite and respectful way, it's okay to teach your doctor about these updates and ask the question. Question number 2, from the tests that are available to me in the United States, if that's where you are being seen, which ones would be right for me? Which ones are actually available? Do you do any of these non-invasive tests? And do you think it's required to get one of these tests? Or can we just make the diagnosis based on my clinical presentation? And question number 3, if we're still not getting a clear answer after the steps that we're talking about doing at this visit, when would you refer me to an endometriosis specialist? It's always okay to ask what is the plan? What are the next steps or the tests that we are going to do? And depending on what we find, when would you refer me on? Because there are incredible pelvic pain specialists, endometriosis specialists, and that doesn't mean that the doctor sitting in front of you isn't a wonderful doctor, but there just are people that have truly dedicated their lives to this very important condition. And if you're not getting the answers, it's still unclear, it's important to ask for a referral to one of those doctors. I hope you found this information educational, valuable. Be sure and like this video if you learned something. Comment with questions that you have. Subscribe to this channel so you don't miss videos and education that I come out on a regular basis. And until next time, stay brave and curious.